Moving on to the next form of psoriasis, which is pustular psoriasis. This variant is characterized by the presence of tiny, superficial, sterile pustules presenting on a background of psoriasis. The most important trigger for pustular psoriasis is sudden withdrawal of systemic steroids. These patients are going to present with sheets or lakes of pus. We never try to give systemic steroids in psoriasis until or unless a specific condition of psoriasis is there. Now, pustular psoriasis can be classified based on the extent of the disease into localized form or generalized form. Localized pustular psoriasis, there are two different variants. First is Palmoplantar Pustulosis and second is Acrodermatitis Continua of Hallopeau. Now, we will discuss it one by one. Palmoplantar Pustulosis. In this variant, the lesions are usually located on palm and soles. This presentation is more common in women, and the age is affected here is 40 to 60 years. In up to 95% of patients, the history of smoking is present. This form commonly presents as erythematous, scaly, well-defined plaques with numerous sterile tiny yellow pustules distributed bilaterally symmetrically on the thenar and hypothenar eminence of the palm, sole and sides of heels. The pustule may be tender and evolve to form a dark brown adherent scale and crust. Next is Acrodermatitis continua of Hallopeau. This variant can affect almost all age groups, with female being more commonly affected. Fingertips are more commonly affected side than toes. Subtle trauma often produce a lesion which starts as a glazed erythema of the fingertip covered by scales. Subsequently, minute pustules appear with an involvement and destruction of the nail. With progression, the digits tends to become extremely painful with tapering ends. In long-standing cases, even underlying bony changes may occur, resulting in osteolysis of the distal phalanx. The condition tends to be chronic and persistent. Now, if we look at the generalized form of pustular psoriasis, classified into two variants, first acute form and second is the pregnancy form. The acute form of generalized pustular psoriasis is called as von Zumbusch type. In this, the skin lesions generally starts abruptly as multiple erythematous tender plaques that soon become studded with pinhead-sized tiny sterile pustules, later colonizing to form lakes of pus. The patient may experience feature of systemic toxicity such as fever, chills, malaise, polyarthralgia. Soon the plaques colonize to give rise generalized erythema and then scaling and crusting. Now the pustule may dry up to 2 to 3 days and exfoliate as thin scales or as brown crust. At the same time, fresh crop of pustules erupt on the shiny underlying skin and the cycle is repeated. The disease may last for weeks or even months. Now, due to the prominent systemic features, we can potentially have life-threatening complications such as bacterial superinfection, sepsis, and dehydration. Severe pustular psoriasis can be difficult to control and require a potent treatment regimen with rapid onset of action to avoid life-threatening complications. Drugs commonly used include methotrexate, cyclosporine, oral corticosteroids. The second type is pustular psoriasis of pregnancy. It is also known as impetigo herpetiformis. Now, please remember, this is a misnomer. Misnomer means impetigo is a bacterial infection, herpes is a viral infection. Now, this condition has nothing to do with bacteria and virus. So remember, impetigo herpetiformis is a pustular psoriasis of pregnancy. This is considered as a special variant of generalized pustular psoriasis, which occurs generally in the last trimester of pregnancy. This particular entity has a tendency to reoccur during subsequent pregnancies. The onset of pustular psoriasis with a tendency to spread and form enlarged ring. The characteristic features are pustules on the ring-like erythema that sometimes resemble erythema annular centrifugal.